Hi Martha, I'm Carrie, a student of occupational therapy. I'm here to bring you some information about type 1 diabetes. So when we talk about diabetes, it means that the body is unable to produce or use insulin effectively, causing the inability to maintain a stable blood sugar level. Type 1 diabetes is considered as an autoimmune disease. It's like a self-attack reaction in our body. Unfortunately, it is still a life-lasting disease. However, there are plenty of strategies to help patients to live with it. Although this type of disease is one of the common chronic diseases of childhood, it can happen in any age. 50% of patients are diagnosed after entering adulthood. So when people have diabetes, they may find some behavior changes. Three significant ones for type 1 could be peeing a lot, drinking a lot, and losing weight on purposely. However, besides these, they may also suffer from easy get hungry, blurry vision, weakness and fatigue, slowly heal sores, and easily infected than usual. Type 1 diabetes is relatively uncommon in Australia. Around 13,000 children and young adults had this disease in 2020. It is around 0.2% of the total population, and the prevalence rates remained quite stable between 2014 to 2020. The cause of type 1 diabetes is unknown. However, there are some suspicious reasons. The first is from genes. People with this type of diabetes often have siblings or parents in the same situation. The other reason might be the environment. Some researchers claim that when people are lack of vitamin D or affected by a virus, they may also get type 1 diabetes. As I've mentioned, even though there is no method to cure diabetes, it is possible to control it. However, if patients cannot manage it, some complications may occur. Low blood sugar level happens quite common. It may be caused by the misuse of medications, having too much or too less insurance. Other complications would be like cardiovascular disease, chronic kidney disease, oral issue, and hearing and vision loss. Also, the nerve damage can cause the SIRF1 infection, and when it goes bad, amputation is often needed to prevent the infection from spreading. The two common ways to diagnose diabetes are the blood test and urine test. In the blood test, we focus on the blood sugar concentration to see if it is too high and the presence of autoantibodies in the blood. Also, we check whether there are ketones in urine because ketones are produced when your body burns fat instead of blood sugar of energy. So when this happens, the unused blood sugar will remain in your body and create a high level of them. To manage the blood sugar level, insulin shot is needed during the day to control the blood sugar overnight and between meals. This is what you and Jessica are already doing. Another important thing to do is regularly check the change of blood sugar. As detailed as you understand these changes, as possible as you and Jessica control the key element that may cause to rise or fall in blood sugar, and you can keep or prevent them. Lifestyle change is also necessary to live with this disease, and we will talk about that in detail later. About diet management, it is highly recommended to have balanced meals containing protein, fat, and carbohydrate like rice or bread in every meal. However, it is better to choose the low glycemic food like brown rice and have less processed food and less high-fat meals. Eating this kind of food can delay the rising of blood sugar. The benefit of eating health is to help Jessica control her post-meal sugar level. However, research finds that some children with type 1 diabetes may have poor linear growth and less weight gain because of the over-restricted carbohydrate diet. So it is important for you to remember that Jessica has to consume adequate bread or rice every meal. Besides smart food choice, building the habit of exercising is important to Jessica as well. Exercise can improve insulin sensitivity and reduce risk of complications, which is truly helpful in maintaining the disease. However, researchers found that children with type 1 diabetes are less active than the children of the same age due to the parents' concerns about low blood sugar and children not confident of themselves attending physical activities without feeling bad or fatigue. What we can do to help Jessica is that we can prepare some snacks for her to eat before activities or when she feels unwell during exercising. Also encourage her to try to do some exercise as well as provide compliments when she attends physical activities. Here are some barriers and enablers of Jessica's disease management. Let's start with personal factors. One of the barriers may be the condition of being excessively fatigued and having fluctuating blood sugar. Both of them will reduce Jessica's motivation of attending physical activities. As I have mentioned, the importance of exercising to the patient with diabetes to control blood sugar level. If Jessica cannot do it, her condition may go worse, and she will fail on symptom condition management, which is one of the daily activities Jessica needs to do after having diabetes. And this can cause sadness and depression to Jessica. Fortunately, Jessica loves playing basketball, which can be an enabler to develop the habit of exercising. So playing basketball is a kind of aerobic exercise, which is one of the recommended option of people with type 1 diabetes. So we can encourage her to continue doing it as a daily exercise. However, this may also be a barrier because high intensity activities, just like basketball, can cause elevation in blood sugar level. So we should always be really careful about the level changes after she's doing it. So another enablers to Jessica's disease management would be the social support from school staff. The supportive school teachers, students, and nurses has been reported helpful by children with type 1 diabetes, and also they create the success of diabetes management and maintenance at school. They can help check and supervise Jessica to do her self-care properly and remind her when the blood sugar has significant change and provide help when she feels unwell. Also, they play crucial roles to explain the situation that Jessica is facing to peers to reduce the misunderstanding between them. For example, if Jessica have to stop and eat during the PE class, others may not tease her if they fully understand the reason. Because of diabetes, Jessica have a new daily activity to do, which is nutrition management. It is hard to complete in schools. The temptation of sweets and high-fat food in the school environment cause the negative effects of this occupation. First is that if the children cannot stop themselves having this food, it may cause the change in blood sugar and cause their physical body. Also, it may also cause the sadness and depression because they cannot eat the food that other peers do. Some of them even become mental illness, having food disorder. So this is the brief overview of type 1 diabetes and the challenges and the enabler that you and Jessica may have. And if you have further questions, please don't be hesitate to talk to me, and I'll keep working with you to live with this disease.